Governor. Good afternoon, everyone. Thank you all for being with us once again. As the governor said, we get started with the data. We have 113 new cases to announce today. There are 182 people with COVID-19 currently hospitalized in Rhode Island, and we have 37 people currently in the intensive care unit. 23 of those 37 people in the ICU are on a ventilator. Sadly, we have 16 additional COVID-19 associated fatalities to report today. 3 people were in their 60s, 3 people were in their 70s, 6 people were in their 80s, 3 were in their 90s, and 1 person was older than 100 years old. Our sympathies and our prayers are with the families of these Rhode Islanders whom we have lost. When Dr. McDonald was here yesterday on my behalf, thank you, Dr. McDonald, he referenced some guidance that the Rhode Island Department of Health was planning to share with nursing homes and assisted living facilities. We have shared in the past, as the governor has made clear, that phase 2 will continue to restrict visiting to nursing homes and assisted living facilities, but we said that we would use this time to prepare for a thoughtful, careful way to address this in phase 2. The intention of the document that Dr. McDonald referenced yesterday is to help facilities begin to think through and develop their own plans to allow for safe visitation. I do want to be clear that visitation is still currently not permitted in Rhode Island nursing homes and assisted livings now during phase 2. But we want to support facilities to start developing plans on how visitations can happen safely as we move towards phase 3. The document we shared lays out some considerations and guidance for facilities in many areas, including screening appropriately, distancing, scheduling of visits, the duration of visits, hand hygiene, and many other topics. Each facility is different, and for that reason, we're not taking a one-size-fits-all approach. What we're doing is giving facilities very clear guidance with clear parameters, and then asking them to develop plans that fit within that based on their own unique physical layouts, their own resident populations, and their own other factors. We will review facilities' plans in the coming weeks. I want to address one last topic. Earlier this week, and as the governor just shared, we mentioned that staff from the Rhode Island Department of Health have expressed interest in volunteering at peaceful protests at which people are making their voices heard about racial injustice. There will be volunteers from the department as well as community partners and others who want to join. Our aim is to ensure that when people are coming together to make their voices heard, measures are being taken to prevent the spread of COVID-19. We are going to be providing masks, encouraging social distancing, and making COVID-19 resources available. This is an example of the Rhode Island Department of Health acting on its mission, along with its partners, to help to address an immediate acute health issue in terms of COVID-19, and to also act on and address the structural issue of racism, which has broad impacts on health outcomes. As has been said, our vision in Rhode Island is that everyone has an equal opportunity to be healthy in Rhode Island, regardless of your zip code, race, ethnicity, sexual orientation, gender identity, and level of education. And that's why RIDO, the governor, and our whole COVID-19 response team has made equity such a clear focus. For people who are planning to also be at demonstrations, and for everyone throughout Rhode Island, please continue to keep in mind the measures that the governor shared prior to heading out. First and foremost, as mentioned, stay home if you are sick. It's been a primary message, and if you have symptoms, it is important to stay home. Also, as the governor has shared, think about those who live in your home. If you live with an older adult or someone who has an underlying medical condition or someone else who is at higher risk, it may not be the best idea for you to be at a rally. There are many other ways for you to get involved that don't always involve being at a demonstration. If you head out, remember, keep a distance of 6 feet from other people, avoid physical contact, greet each other from afar, and signs can be used to get your message out. This is safer for all than chanting or yelling, since this can spread COVID-19 if you don't know that you have it. That's why we will be giving out masks, cloth-based coverings, because that is key. And finally, if you have not downloaded the Crush COVID RI app, this is the perfect time to do that. We want everyone to be able to express themselves, particularly on certain topics as important as addressing racial injustice, and we want to make sure that people do so safely.